right, good afternoon. It's my honor to be able to finish off today's forum as the last speaker, and my topic would be biological big data, battling for humanity, because essentially we're living in an age of a pandemic, and there are many human diseases that we overcome or we are currently suffering, and in the future, I'm sure we all at the back of our heads have something in mind, maybe possibly COVID-20 or any other pandemic that could threaten humanity. And as CEO of Qale Healthcare, I want to mention biological big data and bioinformatics and how this could be leveraged as introducing tomorrow's healthcare. First, let's talk about some fish. To begin with, we're going to talk about the difference between data and big data, and since we're speaking about biological big data anyways, I decided to talk about some biological species. In front of you, you see three different pictures, one fish, a couple fish, and a huge school of fish. If you take a look at the first picture, and let me ask you a question. Do you know where it's from? You know where that one fish is headed? I highly doubt that. Maybe on the second picture, there are a couple fish. You might be able to tell where it's headed, but do you know where it's coming from? That's a very different question. But if you look at the bottom, it's a huge school of fish, and you see where it's coming from, and you might not have an exact pinpoint idea of where they're headed, but you clearly know that they're headed, and you can, in a ballpark, assume the direction of where they're headed. The reason why I started off this speak with fish is because this is no big different from how we should treat diseases and how we should interpret their data and how we should maybe treat those data. So, big data in the time of big viruses. Today, we're living in a pandemic, and I think we need to really think about how we've been utilizing the biological big data that we've accumulated thus far, how humanity has made an initiative to do the better good for mankind, but have we done so well? I think that's a question you all should answer, but at the end of the day, the COVID pandemic has been going on for nearly a year. In Korea, the government has been doing very well, but in many other countries, unfortunately, there has not been that much control, and this, I believe, is from the result of not having a great set of data that we can interpret and leverage at the time of a crisis. I mean, there's nobody to blame because good data has let big pharmas, biotech companies, and them get thus far. But in the time of a crisis that threatens humanity, imagine all academic institutions around the world are tackling COVID, but we still do not have a vaccine, nor do we have a therapeutic. Of course, this virus has its own traits, but would that be the only reason? So, how is big data used in our day-to-day lifestyle during this pandemic? If you look up front, and if you look at your phones, maybe every hour or so, you'll be receiving a notification from the government saying, you're in an area where X number of people have been confirmed of COVID, and so you should be careful. But is that enough information for you to not be able to catch the virus, or just to give you a mind that you're in a safe area, maybe because there's only 5 people in the same area? What if there are people that have not been confirmed of having the virus? So let's talk about how data is accumulated during this pandemic and what they result in. A couple experts ahead of me, they've all mentioned about the technical details and the market landscape and the global status on how we're developing therapeutics and vaccines for the COVID virus. But in a nutshell, you get carried to a quarantine facility if you've been tested positive, and your sample is sent to a lab where they could analyze it for confirmation of your having caught the virus or not. But is this actually enough? The reason why I ask this question is because we need to approach diseases in a different way, in a way that we've not approached them before. It's because if prior we were more focused on well-being during a disease, maybe not catching another disease that's pathologically driven from the disease that you currently carry, or maybe just simply not being in pain through different drugs or cocktail therapeutics that you've been applying on your body. But how about after disease? Have you encountered anybody who has gone through chemotherapy? Or maybe even on YouTube or social media, you might have seen a lot of videos where people show you in a visual format what it is like living after they've overcome, and I emphasize that for a reason, the COVID virus. In front of you, you'll see a portfolio of COVID symptoms, and these symptoms also appear after they've overcome this virus. So, hair loss to begin with, and migraine, loss of smell, difficulty walking, confusion. These might not seem like big side effects, but having gone through the virus, a very lethal virus, especially if you have diabetes, it is known that the lethality rate of catching COVID while you're a diabetic patient is around 90%. But if you have to go through these after having been a healthy person before having caught the COVID, what a devastating state. So, healthcare today, even during the COVID pandemic, I don't find it any different because you don't see it coming, and the reason why you're in 14-day quarantine is something you need to think about. The reason why you're in quarantine is because you do not see any symptoms that are occurring within your body that actually tell you that you have COVID. And I mean, some of the tests today do, but back in March, back in February, those tests weren't able to tell you if you've had the COVID and if you're in non-symptomatic state. So, today, we're in the age of fourth industrial revolution, and healthcare, unfortunately, hasn't really been able to keep up to its word. And let's see what Healthcare 4.0, also known as hyper-personalized healthcare through biological big data, and what should we expect in this age? So, precision health. I've stumbled upon this picture on the internet, and this pretty much in a nutshell gives a comprehensive review of what precision health or even personalized healthcare, AI-driven, machine learning-driven or not, should be able to give you. The first image on the left says genes, but this could be any omics data, genomics, proteomics, metabolomics, and any other omics data with the environment that you're living in. Because people, depending on your geographical location, you're exposed to many different chemicals and environmental factors that you do not really feel to your skin, that are deteriorating your health, that are detrimental to your health status. And also, lifestyle. Using these smart devices that collect your LifeLog data, these different types of data sets combined in a single module in a presentable manner, and using innovation or technologies we have readily available today. Not the fact that they're technologies, but technologies that are used by the right group of people. If those are all put together with diverse partners, and in terms of partners, I want us to all think about in a more wide sense or a more comprehensive sense. It's not only going to be biotech companies or pharma companies, medical institutions, academic institutions, it's every single one of us. Because as you've seen from the fish example, the more sets of data we accumulate, the more accurate and the more foreseeing we become. And therefore, due to an accumulation of all these various different sets of data, and most importantly, interpreted in a way, shape, or form that people can understand, then we all become healthy. So, the solution to coming of an age of Healthcare 4.0 would be 4P healthcare. Let's talk about the first, participatory, predictive, precision, and preventive healthcares in order. If 4 of these components come together in an age where we would continuously see challenges that humanity faces, especially literally in the sense of dealing with human lives, we could bring forth healthcare of tomorrow. First of all, participatory healthcare. The reason why participatory healthcare comes first is because of an aforementioned term of having diverse partners, or just having everyone on board in general. The more data we collect, the more accurate we get, and the closer we get to 4P healthcare. And as there's an old saying, getting started is half the process. Sharing is caring, and by everyone's participation, the more the better. We can have a great idea of how to predict what your health is going to look like in the near future. So what this predictive healthcare means, you might have seen movie trailers or maybe book summaries before you purchase a book or go to the cinema to watch a movie, but what do? They get you all excited about what the plot would be, and they get you excited about the cast and their action based on a very short excerpt. But what if you get the chance to predict the future of your health? Would that not sound exciting enough? Then, if you have the power to predict your future, you can pinpoint when, where, in which way, shape, or form you are prone to a disease and how you will get the disease. And we call this health guidance tailor-fitted for oneself. And as aforementioned, Healthcare 4.0 defines a hyper-connected world where everyone could easily access hyper-personalized healthcare, and therefore precision healthcare also used to be one of the government initiatives that the Obama administration had gotten started. And ultimately, we achieve preventive healthcare. Why is prevention so important? Because just ask many people if they had the choice to have a single superpower, what would they have? I mean, my best take would be being able to travel in time. But if you can't switch time, why don't you change your health status, and why don't you fast forward it to a healthy past? So we call this fast forward to one's healthy self by being able to prevent a disease by knowing it at its very early stage. What kind of data do we need to collect to develop 4P healthcare and to bring it into reality? It's longitudinal data. And in order to do this, we need to track the secret behind diseases. So what types of data consist of longitudinal data? It's the same humans, but tracked over a long period of time. Especially, most effectively would be during these four processes. So pre-symptom biomarkers, early symptom markers, disease indication markers, and even recovery and care markers. The reason why we need to compare and contrast these four different time frames of one going through a disease is because we need to be able to pinpoint what kind of small signals within the body make one at a certain stage. And to be honest, your brain doesn't know if there are any pre-symptom biomarkers, but technology today in the 21st century, they do. And the people who know how to use those technology, they do. So why don't you let them do the work? So what's the result? Diagnostics, therapeutics, and most surprisingly, digital therapeutics. Digital therapeutics is a clinically proven new criteria approved by the FDA. Recently, a new guideline has been set out by the Korean FDA, known as KFDA as well. But these three different types of therapeutics and or diagnostics would become a next trend because these are more personalized and more useful and more effective to you, not to anyone else, to you. And that works through, we take a proteomic approach. So the cool thing about proteomics, we've seen people talk about genomics earlier on today, but let's talk about proteomics for a second. Proteomics is in your bodily fluid, and it carries all of it through traveling around your body. It carries all the signals that, or either alarms or good signals, but everyone has a golden ratio of protein composition in one's body. But if that's broken, long story put short, that's when you get a disease. So if you are able to detect a wave while it's accumulating before it crashes after it hits its peak, what if you can early on attack those protein markers from maybe being formed or being degraded in the first hand? So, quite frankly, although we're leveraging proteomics, multi-omics approach is very crucial because unfortunately there have not been so much proteomic applications in healthcare quite yet, and we're also pioneers as a startup in Korea. And multi-omics, since genomics, microbiomes, and metabolomes have been having a little more of a track record, why don't we just connect the dots? There are a lot of omics out there, and this is a Nature published material, and it shows you the different omics that can be collected from a human body. But with today's technology, to pinpoint, to revolutionize 4P healthcare, genomics, proteomics, gut microbiome, and metabolomics play a crucial role. And our data solution is AI, machine learning, all those big words, and those tools used to interpret it, combine it into a single module, and to give a human or give the end user or give the patient or even a healthy person a more precise analysis of one's body condition and giving them the power to monitor it. So, what should be the future and what should we be looking forward to? Actually, as I mentioned, accumulating as much data as possible and the types of data that we need is very crucial to bringing forth 4P healthcare to the world. And this will not only improve your lives, it will improve those that have similar body compositions as you do, and it will also improve that of the next generation. And if you can't do it for yourself, why don't you do it for others or your families or your loved ones? Thank you very much.